Assalamu alaikum. I am Dr. Refat Tabassum, Associate Professor, Bashundhara Ad-din Medical College, South Keraniganj, Dhaka. Today we are going to discuss about volume disorder. Volume disorder, it is classified into two types, volume expansion and volume contraction. Volume expansion included hyperosmotic volume expansion, isosmotic volume expansion and hypoosmotic volume expansion. And volume contraction included hyperosmotic volume contraction, isosmotic volume contraction and hypoosmotic volume contraction. Now, hyperosmotic volume expansion. In this disorder, volume is increased due to excess accumulation of the solute. The body receives or retains mainly sodium ion, and the causes are primary surplus of the mineralocorticoid, that is Cushing syndrome, chronic renal failure and massive sodium intake, especially seawater. Isosmotic volume expansion. In this disorder, volume is increased due to excess accumulation of the isosmotic fluid. Body retains isosmolar fluid, and causes are intravenous infusion of the isosmolar fluid, nephrotic syndrome, cirrhosis of the liver and cardiac failure. Hypoosmotic volume expansion. In this disorder, volume is increased due to excess accumulation of the water without salt, and body retains water. Causes are infusion of glucose solutions and psychogenic polydipsia. Now, hyperosmotic volume contraction. In this disorder, volume is decreased due to loss of water or administration of excess salt. Body does not receive or it loses water. There are some causes, they are vomiting, diarrhea, sweating, insensible water loss, fever, hot environment and hyperglycemia in diabetes mellitus and diabetes insipidus. Isosmotic volume contraction. In this disorder, volume is decreased due to loss of isosmolar fluid. The causes are hemorrhage, burn, draining of the ascitic fluid, diarrhea and intestinal obstruction. Now, hypoosmotic volume contraction. In this disorder, volume is decreased due to loss of excess salt. Body do not lose salt, mainly sodium. The less intake causes are less intake of sodium condition combined with loss of sodium ion, and primary lack of mineralocorticoid, Addison's disease, renal salt losses, polyuria in acute renal failure. Now, dehydration. Dehydration is a condition characterized by depletion of water and salt in the body. It may be due to insufficient intake or excessive loss or both. It is generally two types, due to loss of water alone and due to deprivation of water and electrolyte both. Causes of dehydration: diarrhea, vomiting, excessive sweating, burn, Addison's disease, diabetes insipidus and uncontrolled diabetes mellitus and renal failure. There are 3 degrees of dehydration: mild, moderate and severe. In mild, there are 5% loss of weight, and moderate 5 to 10% loss, and in severe cases 10 to 15% loss. Now, the salient features: the volume of the extracellular fluid, that is plasma, is decreased with the rise of electrolyte concentration and osmolarity. Number 2, water is drawn from the ICF, that results in the shrinking of the cells and disturbance of the metabolism. Number 3, ADH secretion is increased. This causes water retention in the body and consequently urine volume is very low. Number 4, plasma protein and urea concentration are increased. And number 5, water loss is often accomplished by the loss of electrolyte. Clinical feature: increased pulse rate, low blood pressure, sunken of the eyeballs, decreased skin turgor, lethargic and confusion and ultimately coma. Treatment is intake of plenty of water and salt. If unable to drink, then administration of the isotonic fluid intravenously. Now, water intoxication. Water intoxication or overhydration is a condition developed by the excessive retention of the water in the body, and causes are excessive water intake, large volume of water intake with large volume of salt free fluid, renal failure, overproduction of the ADH, major trauma or operation and lung infection. Characteristics features of the water intoxications are associated with dilution of the extracellular fluid and intercellular fluid with decrease in osmolarity. The clinical features are included headache, lethargy and convulsions, and treatment are the stoppage of the excess water intake and administration of the hypertonic saline. That is all for today. Assalamu alaikum.